My name's Jason Jarrod. I'm an exercise scientist and an exercise physiologist. Every injury is unique and every fitness goal is unique. Work with me and you'll get the professional direction you need with your situation. Welcome back. Today I'm talking about the quick fix. What is the quick fix? What is the quick fix? Let me tell you something. There's two physios on YouTube and I used to like them because they're great. They're friendly and charismatic and they're sort of casual and relaxed and there's a good thing going on. There's a good vibe. But lately, they've started this whole one exercise that will fix your back pain or one thing you've got to avoid if you've got a lower back injury. Guys, come on now. There is no one thing for everybody. There's no quick fix. Unfortunately, this is not a popular sentiment to be expressing because it doesn't sell well, does it? I like things that sell well, that are true, of course. But this crap about one thing you must avoid, there is no one thing you must avoid. You can do anything if you step up to it appropriately, if you've trained for it, if you've rehabbed for it. There's no one thing. Stop it. Stop saying there's one thing that you should avoid or one thing that will fix this or there's no one thing. There's never any one thing. Now, with that said, there's a caveat. Sometimes clients will ask me a question along these lines. I'll be like, well, generally, this type of exercise for most people is going to be a pretty high risk situation. That's the most you can say. If someone hasn't seen you and assessed you and is not familiar with your history, there is no way they can tell you shouldn't be doing something or you should be doing something. Absolutely no way. Never let somebody online, and this is why I don't give specific advice to people online, and you don't see videos from me saying, oh look, here's how to rehab your shoulder injury. Well, look, the most I have on this channel is a Pilates video for back injury rehab. Now that's quite generic, and that Pilates posture type stuff, and I've spoken about posture. There's a place, I know there's a place for posture and Pilates. I won't get distracted. Okay, let's put that aside. I'll come back to it. Just remind me, okay? So, they crack me up. I really do. And I've distracted myself. I'm not even going to cut this out. It's just, I'm having too much fun. I'm just going to leave it in because I know you'll love this. What was I talking about? So there's no quick fix. That was great. This channel is awesome. Tell me it's not. So there's no quick fix. There's no quick fix. People can't give you advice. Think about it. So what's your exercise history? What injuries do you have? What goals do you want to achieve? What is your biggest barrier? What's your movement capacity and function look like? Do you see all the variables now that are occurring? I don't know any of those things about you. And neither do these guys who are giving you or telling you directly, don't do this for your back or do this for your back. No. Now, the most we can do is be careful and say, look, we know for chronic lower back pain, most people have a posterior disc bulge. Most of them tend to be L5S1 disc bulge, tend to cause sciatica, which we know sort of resolves in this time frame. And we've got rehab protocols we follow. It's all a template. And our job as professionals is to look at you as an individual, not treat the symptoms, not treat the injury, treat you, treat the person, and in fact help the person treat themselves. We need to empower you more than anything. So unfortunately, people who are selling you one answer fixes all or one thing not to do, and they are selling, even if you're not giving them money, they're selling an idea and you're buying it, and then it's not empowering you. Our job is to empower you. We need to empower you. So unfortunately, these quick fixes don't work. They most often don't apply. They may not be suitable to you. And I just think you need to be really cautious of it, and they piss me off. So that's why I think you should not pay attention to them. Everything needs to be individualized. Steer clear of the quick fix.